After carrying a pregnancy for 9 months, all a woman ever wants is to go home with a healthy baby, whether they labor for hours or go for a Caesarean section delivery. From the numbers that the country is seeing, especially from private hospitals, and after the introduction of Linda Mama, CS deliveries are on an alarming increase. Is this purely money pushing for the cart? Well, Joanne Letting examines this data and how CS is delivering riches for a few.
Silva Kirui, a teacher in Rongai, Nakuru County, is now a mother of 5. After 3 successful normal deliveries, she was reluctant to deliver her twins via cesarean section, despite this being medically indicated. She was terrified.
Anesthesia mwenye alikuwa nyuma yangu akaniambia, "Madam, ni nini mbaya?" Nikamwambia, nasikia ni kama ni hewa inanishia sijui ama ni nini.
Though she considered a normal delivery better since healing is faster, her husband, a clinical officer, convinced her otherwise. One of the twins had not turned at term, and she had to face the surgical blade.
The ultrasound showed that there was transverse lie of the child.
Though the surgery was successful, she endured countless days and hospital visits, which turned to a month for her incision site to heal. The couple parted with 30,000 shillings for the delivery. Charges, she says, were fair because of their medical cover. Josephine Chemtai's experience was not as rosy. After hours of labor and profuse bleeding to deliver her 5th child, she had to undergo an emergency CS. Healing took 3 months, but she still carries the scars of this experience due to chronic back pain.
Toka siku hiyo sijeshika laini vile, hata kazi mzito siwezi fanya juu ya mgongo.
Professor Marlene Tamaman, who is the chair of the Department of Obstetrics and Gynecology at the Aga Khan University, Nairobi, says that this surgery is seen as a cash cow, and there is an increase in unnecessary C-sections conducted in Kenya and globally.
It's the doctor who holds the knife, so very often it's the doctor who is kind of preferring to do a cesarean section, but also women, they are asking for it. And why is that? Many women have fear of childbirth, more specifically, fear of pain.
Since the introduction of Linda Mama, the number of CS deliveries have since more than doubled. In 2017-2018, 28,454 women delivered via CS under the program, compared to 64,523 in 2019-2020, accounting for close to 10% of the total deliveries. This has been an almost 10,000% increase in CS delivery payouts done by NHIF since 2017, when 5.5 million shillings was utilized for CS, compared to 486 million shillings in 2020. The difference in cost of CS deliveries between private and public hospitals is big, with public charging between 50,000 to 100,000 shillings, while the private charge even more than 200,000 shillings. The average rate of CS in private hospitals is about 53%, but some go to as high as 80% C-section deliveries. The World Health Organization recommends that a country should have CS rates of 10% or lower. Despite the fact that this life-saving surgery is still unavailable for some women in far-flung counties, the procedure is overused in urban and better developed counties. Joanne Letting, KTN News.